Nazia, so nice to have you.
Nice to be here.
Someone with a really big head had this on yesterday or the last time I was here. Probably was me. I don't know. So Nazia Iftikhar, thanks so much for coming on and providing content to the PP Harmony community. And then, of course, your work with Back to School Health or Back to Health or whatever the heck you're going to call it. We're going to figure that out as well. But you are someone that I really want to talk to, not just today, but in the future, because you represent something I don't have, which is someone with a medical degree. And we're going to get into your background and a little bit about where it is that you are today in your healthcare professional journey. I first met Nazia over 10 years ago. We had a mutual friend. And then both of us have been through life. And we connected and our friendship grew, sharing our struggles during my journey in mental health recovery. She was one of the people that provided me guidance, provided me support. And so I'll always be grateful for that. So before I turn it over to you, I want to just formally introduce her. Nazia Iftikhar is a nurse practitioner with over 13 years of experience providing healthcare in schools and urgent care facilities. She is currently completing her fellowship in Integrative Medicine with a focus on psychiatry. And she is here today to share with us what she's learned. So thanks again, Nazia, for being here today.
Thank you, Imran. I am stoked to be here. I'm excited about talking about a subject that I feel very passionate about. And I appreciate having this platform where we can collaborate together to share our knowledge with our followers.
Nice. So walk us through your education as a healthcare provider, as a nurse practitioner, and what has led you to the wonderful world of what we're going to talk about today, integrative medicine?
Absolutely. I have been a nurse practitioner for the past 13 years, like you mentioned, primarily in the Houston area. While I am a family nurse practitioner, I originally gravitated towards pediatrics. I've always loved pediatrics. I've worked in pediatric urgent care settings, and for the past 5 years, I found a setting that I felt particularly excited about, which is school-based clinics, where I was the primary care provider for the patients in the school, and that's where the clinic was located. I got to know the families really well. I got to see my patients grow up and see them walk down the hall and wave at me, and I felt a particular attachment to them and always wanting to do right by them as a result.
Nice. Yeah, one thing I can say from the BP Harmony community is you have people going through it with their mental illness, but you also have family members who are equally, if not more, interested in getting knowledge, getting information on how to best care for their family. So I'm glad you have that insight that being in schools, I can imagine you're also dealing with parents.
Absolutely. And the neat thing about being in a school is I had more frequent follow-ups with my patients than you would have necessarily in a standalone clinic where the parent brings the student in. With the consent of the parents, I would be able to see my patients closely and follow them and check it to see how they're doing. And that gave me some unique insight. And that's why I was able to get to know my patients in a more in-depth level.
Nice. So you've told us a little bit about your conventional education. Walk us through how you got to where you are today with conventional experience. And you mentioned to me before this conversation gaps in the care you saw and some of the criticisms that you received even in your own personal approach.
So going back to what I just said about getting to know the patients in another depth, another level, for, your typical common illnesses, such as maybe a strep throat, you would treat them, you would swab them, treat them, and that would be it. However, I did see a population where of patients where they would be coming back more frequently, or their initial treatment would not be addressing their concerns, or there was some underlying chronic issue. And what would end up happening was that I was at a point where I had to decide, how do I help my patient then? And if I offered them my conventional medicine, where I would treat them initially and then consult with my supervising physician or refer, I felt like that specific model did not necessarily address their needs. There was a gap, first of all, because if I referred to a specialist, there are wait lists. And also I felt like there were questions that I wasn't necessarily asking them that I wanted to ask them. So I ended up asking those questions, such as their sleep and their deficiencies, their vitamin deficiencies, their diet. And I saw myself being a very thorough provider. And that is also where I got the criticism that perhaps I'm a bit too thorough with my assessments.
That's weird, but I see what you're talking about, because if I'm concerned about running maybe an efficient clinic and someone's coming with strep throat, why are you asking about their diet?
Exactly. So when I would see a patient with strep throat, except I would see them multiple times, light would go off in me where I would say, what else is going on here? And that's where I would follow my natural tendency to just follow through with it and see what else I can do for this patient.
Okay. So then it seems like you had a choice, either to fall in line, to maybe do as you were being told, or to do something else. You mentioned earlier a certain crossroads that you faced in your career. So tell us about that moment. Maybe there was a particular incident that led you to say, you know what, there's something off here, and I got to find another framework to approach healthcare.
I saw patients repeatedly, and I would try to help them, which meant that I would order a few more labs than usual, or I would investigate further their health history, or I would follow up with their specialists. And all of that took time, and I was at a crossroads, and I had to ask myself, when I was told that perhaps I was too thorough, what do I do now? Do I work on my efficiency, which is a very fair thing for me to work on, or do I decide to follow my tendency to be thorough and go to another path where I can be that thorough provider for my patients?
So what did you decide?
I decided that I would follow my heart and become a more thorough provider, and that's where I started looking into the options of functional medicine and integrative medicine, because I saw that those providers were asking this very same questions that I was asking, and that there was an underlying framework, and I did not have to start from square one, and that the template has already been laid out for me.
Awesome. So you didn't have to, so you found out when you started probably searching online maybe, or asking around, that there were people like yourself.
There were like-minded people.
Okay.
And that's when everything changed. And I signed up for a fellowship in a program for integrative medicine.
Okay. So fast forward to today, next month you'll be completing this fellowship. You'll have a couple more letters at the end of your name. What is integrative medicine now that you are nearly, completed with your fellowship? And, we'll dive into a little bit of how it can help people with bipolar disorder, and, how it helps other people with like the other patients that you work with.
I'm so excited about talking about this because I feel...
by the way, when she says she's excited, this is an understatement. Like the amount of notes I've seen her write and the amount of rabbit holes that she goes down is inspiring. But at the same time, it helps me put into technical words what I know from experience. And so that's really why I want to bring health professionals in, because like I know, for example, this is the way to go, because that's what got me out of, this lifelong, alleged lifelong mental health illness. Obviously, I say that with, disclaimer saying that there's a lot in what I just said. Maybe, Obaid, you can cut this out. Or maybe not. I don't know. It's a natural flowing conversation. people learn best in a free-flowing conversation. But yeah, little disclaimer that she is very excited.
I am very excited.
All right.
So integrative medicine, the way I see it, is really cool. It is a combination. It's a combination of your conventional medicine, that whether you may be a physician, a nurse practitioner, or PA, and that healthcare professional goes back to school and studies more about integrative medicine options, which is a combination of conventional medicine along with complementary medicine. And the key here is everything is evidence-based. And you may ask, why was this not necessarily combined in the past? And the answer simply is that there was not enough evidence or studies to follow up and to solidify that way of practicing. And
that's healthy to know, because I think in the interwebs these days there's a lot of conspiracy, like, oh, this was covered up or something. But it's good to know that, yeah, maybe this is just the part of the evolution for the Western allopathic tradition.
I strongly believe that eventually all conventional medicine providers will also be trained in integrative medicine, because there will be the studies and the evidence to back it up.
Oh, that is music to my ears, because I think right now in the health and wellness space, you have a lot of either or. Mm-hmm. You have this mentality, it's like you're either this or you're a hippy dippy person that, takes mushrooms and, gets pins stuck on him and does breathing in the mountains, and, you're unscientific. So that makes me feel like, okay, this is an upward battle. Because often it's presented as if like these two are against each other.
Just for an example, let's talk about your journey. What has been your experience with meeting and speaking with a provider with experience in integrative medicine?
Yeah, I mean, I can say that working with maybe an old school conventional psychiatrist, I was quickly diagnosed with bipolar disorder maybe after 5 minutes of speaking to them. And obviously, I was in the acute phases of mania at the time, shifting eyes, interrupting someone more than I normally do, very rapid speech, vacillating emotions between, in the span of a short amount of time, and then having thoughts of grandeur, thinking some sort of momentous shift was about to occur in the world, and having a level of delusional thinking that I had some significant role to play.
And then how did you react when you were told that, now, Imran, you need to start taking medications and that will be your primary treatment option?
Yeah, I resisted it for some time. And it wasn't until someone I really trusted and respected said, hey, I think you are having some form of imbalance. He didn't use the word illness or disorder, but he used the right word to help me understand that, okay, yeah, maybe something is off. So I'll go ahead and take the medication. But I think what was devastating to hear was that I had a lifelong mental illness and that I had to be on mood stabilizers, antipsychotics, and side effect minimizing medication for the rest of my life. Maybe not for the rest of my life, but certainly mood stabilizers. In my particular case, I was told that I had to be on for the rest of my life. And that just didn't feel right to me. In other sessions, I've mentioned that we get a teaching growing up that for every illness, there is an antidote. And I had faith in that was something that even though I might not know about it and the physicians might not know about it, I'm going to hold on to this story that we hear in our community. So yeah, it felt like a life sentence. It felt like I'm only 30 years old and you're telling me the rest of my life is going to be this weird haze where I'm like in a fog while I'm awake, and then I don't know if I'm sleeping because the sleep quality is so poor, and that the only thing I'm told is take these medications and consider talk therapy.
So you were at a crossroads, Imran. You had to decide what you were comfortable with at that point.
Yeah.
And what is it that you decided to do then?
Am I the interviewer or are you the interviewer? What's going on here? No, I appreciate you asking me the question. I really at the, most of, when I went through it in 2019, when I got my diagnosis at the end of fall, most of 2020 was like very heavy depression, suicidal ideation, constipation, migraines, anxiety, insomnia, quite intense. And, my to-do list today is like very different from my to-do list back then, which was like, make sure you take a shower today. Make sure you get out of bed 30 minutes after waking up as opposed to 2 hours. So it was a very different time. And I started experimenting with different things because I was just like, I can't live the rest of my life like this. So I started hearing voices online of people who were on the other side saying it does get better. You can live a full life again. And, I here and there I saw stuff about nutrition. Here and there I found stuff on exercise. Here and there I found stuff on alternative things like acupuncture and ashwagandha and this wonderful thing called magnesium that we're going to talk about later today. And then gardening and yoga, which I ended up, taking very seriously and becoming a certified instructor. And that's, a lot of what I do at BP Harmony.
And thank goodness you did that.
Yeah. I mean, thank God I did because it was there are professionals in the health space, but like you said, it isn't integrated.
So you asked me why I am asking you these questions, and the reason being is I wanted you to imagine a different scenario, and that scenario is, Imran, what if you had gone in and you saw your integrative medicine psychiatrist who not only understood all the different complementary therapies you were trying, but was also a resource for incorporating them with your current medication so that you can ideally taper to the level that you are more comfortable with and thus be more compliant and also understand interactions and side effects. How would that help with your treatment trajectory?
Yeah, I mean, that it wouldn't have been a lonely process. I mean, it just, I think I was telling this to someone earlier today. It's like, I wish I didn't have anxiety or pressure going to go see my psychiatrist, and instead of feeling like I had someone advocating for the things that I wanted for my health, it just felt like I have to constantly battle them not to upcharge me on all sorts of ludicrous tests, number one, that I feel like are not necessary. And number two, it's like, I just feel like I'm being told something that obviously they have a lot of authority, they've done their studies, but something in my intuition was telling me like, no, this just doesn't seem right. And so I just felt like I worked with a physician who was supportive of my idea of getting off of medication someday. But it was this constant like kind of fear mongering of like, okay, you can try tapering, you can try going less, but the moment your symptoms become aggravated, you need to get right back on them because then you could relapse and be in a worse state than you were in before. So that was the kind of tension that I had with any conventional psychiatrist. And then working, visiting an integrative psychiatrist, definitely they take a lot more time, and they will take much more approach in referring you to a nutritionist and telling you, try out these supplements. But even then, I feel like they are still integrative medicine in and of itself, and you can correct me if I'm mistaken, is also in its infancy.
Yes.
My experience with psychiatry is that it's in its infancy, and then integrative medicine is in its infancy as well. And people like myself don't really have time for the science to catch up and for the healthcare to catch up because we have real issues like suicidal ideation that need to be resolved today because we don't know what is going to happen tomorrow. That's how intense like the suffering is.
And that is where I see myself becoming an integrative medicine provider is what if that onus goes away from the patient to find their resources on their own and to have a psychiatrist or a healthcare provider who is well informed on the different modalities and is able to guide you and to connect all of the different modalities in a safe and mindful way that promises longevity in your treatment. How would that change the course of your treatment? And that's why I decided to go into integrative medicine.
I mean, yeah, but that's great. I like the way you went about answering that question.
I myself am a baby. Just, integrative medicine is, a relatively new subject, and the studies are still happening. And I myself have not completed my coursework yet. Yet at the same time, the topics I'm learning about are so compelling that I felt the need to share it with everyone. While I may not know everything, just being able to come here in this platform and teach it to everyone else helps me become a better provider. So I thank you for that.
Yeah. So, I mean, a bit of what I understand from your response is that it is going to take the conventional medical model, what I'll call the allopathic tradition, and then it will look at evidence that is coming from the literature of research that is out there around nutrition, around exercise, around lifestyle, around even things like spirituality. I'm surprised to find that integrative medicine takes that into consideration. It's not necessarily advocating for a particular religion or for particular, but there is some medicine that comes from pillars of faith like hope, like justice. And it's fascinating to see that that's being taken seriously in the scientific community. So now that you've said that that's what integrative medicine does, tell me what is it that you're learning in your area of like specialty of psychiatry? And I know you want to start off the conversation with supplements. And so we can start off with supplements, but maybe talk to us maybe a little bit broader about the approach to psychiatric care through the tradition of integrative medicine, and then we can deep dive into the wonderful world of supplements.
As you had mentioned, the history taking of an integrative medicine provider is quite extensive, where another history taking would take 10 minutes. We could take an hour with what we ask you about. We could be talking all the way back through your childhood, also your experience with trauma, your experience with medications and side effects and supplements, your gut health. My mind was blown to realize the level of incorporation, the level of effects that your gut can have with your brain.
Speaking of which, we're going to do a session on gut health in the future. Okay. Yeah, okay. I've got a nutritionist that is going to come on. Yeah,
I remember seeing some of my patients coming in to see the school nurse quite often with just a generalized stomach ache, and I thought to myself when I used to witness this, what if there is something compelling here that we need to investigate? And in my studies, for example, that is one thorough assessment that we do, and some other ones are sleep, relationships, number of trauma incidents you've had. All of those are interplayed, and they need to be properly evaluated and considered.
All right. So then once you make these evaluations, what is the typical protocol or the typical, step forward that might differ from, what I would say is, eat better, exercise, and some drugs?
There are integrative medicine providers that specialize in different modalities. For example, you might have an expert that will look into mold exposure. You might have another one who could give you a better honing in on your gut health. So we are a network and we refer to each other, but we also have a general idea of where we want to go. And we might not necessarily assess for everything at once. Just like with any other type of medicine, we start slow. We take into consideration what other medicines our patient is on and follow up more regularly to see how it's affecting our patients, any incorporation of whether it may be a supplement or any type of infusion. And so our model is a little bit more nuanced in how we approach medicine.
By the way, since you're having a hard time figuring out a domain name, maybe you could do back to integrative health. We'll see if that's available. Okay, yes. So let's dive into the world of supplements. Talk to me about the place of supplements in integrative medicine, and then the first supplements or first couple of supplements that you're interested in sharing with my community at BP Harmony, but then also with your network that you've mentioned as well.
Absolutely. I think sometimes when it comes to healthcare, we forget to look at the fundamentals. And for me, the fundamentals is vitamin deficiency, and mineral deficiency. So I would love to start with magnesium.
Okay.
So magnesium is the fourth most abundant mineral in the human body.
Okay.
And it is involved in multiple functions, around 500. And so I could rabbit hole about all the different functions for a long time. But I would love to talk to you about how magnesium supplementation could really help our patients who suffer from depression or anxiety or bipolar disorder.
Yeah.
First of all, I'd like to start with a disclaimer, and that is that this is just general medical advice, not necessarily medical advice that I want a patient to follow, because that requires careful monitoring and one-on-one patient relationship. This is general education so that we can have our community feel more empowered, and it is in no way designed to replace your one-on-one time with your healthcare provider.
Right, especially general knowledge doesn't take into consideration things like allergies and a bad reaction with the medication that the viewer may be on. So always, any supplement you consider, any knowledge that you take from these webcasts, please do consult with a physician and make sure that it is safe for you to take on, and then even things like dosages as well. And then obviously, we'll have our links to connect with Nazia directly. You can reach out to her and start working with her.
Absolutely. Just as a refresher, just a basic refresher about magnesium, it can be involved in multiple human body processes, such as regulating nerve and muscle function, such as regulating your blood pressure and your heart, and making muscle, making protein, helping with sleep. And what we particularly wanted to talk about today is its effects on your mood.
Mm. So the reason it's not important, everybody who is watching with bipolar disorder, or someone who's listening or watching to learn about bipolar disorder, the salient feature of bipolar disorder is mood swings. You may be normal for 1 minute, and then for whatever reason, whether it's intrinsic or some sort of environmental factor, you're easily tipped over to anger or happiness or hypersexuality, poor decision making, excessive spending. So there's a level of unpredictability in one's own mood, and a level of unpredictability for someone witnessing it about what is this person going to do next. So yeah, those with BP know that if there's something that can help us with these crazy mood swings, let us know. Absolutely.
I'd like to start off by talking about depression. Did you know that magnesium has a strong link with depression? In fact, some researchers also found that magnesium deficiency may be the missing link for treatment-resistant depression.
What's treatment? What do you mean by treatment-resistant depression?
When you as a provider have tried every modality to treat the depression, whether it may be your first-line treatments, and it is to the level where there's significant suicidal ideation and hospitalizations, and all conventional models have been depleted. That is something very basic that also should be considered as a cause towards the depressive symptom. For one, it's used by our body to regulate neurotransmitters like serotonin. And what are neurotransmitters? They're natural chemicals that send messages between nerve cells. Serotonin is what regulates feelings of happiness and anxiety. Mm-hmm. And the key is to have an optimum level.
Okay.
And magnesium helps your body have a balanced optimum level of serotonin. In addition to regulating serotonin, magnesium boosts something called BDNF.
BDNF.
And that stands for brain-derived neurotrophic factor. And just to sum it up, it's brain fertilizer.
Okay, you're talking to a gardener here, so I think I'm following.
So imagine if the network of nerves in your brain are like leaves and branches.
Okay.
BDNF is what prunes the old, poorly functioning, damaged nerves.
Okay, the branches.
So that your body can make new ones. Just think about those pristine hedges you see when driving down the neighborhood. There is a gardener who has been tending to those hedges carefully, and BDNF is that gardener.
Interesting.
And guess what else increases the BDNF in your brain?
Food?
Mindful exercise, specifically yoga, has been linked to increased BDNF.
Okay, well, tell me more, because we do a lot of yoga at BP Harmony.
There are studies too that have measured BDNF levels and comparative studies comparing mindful techniques such as yoga and how they are implicated in increasing those BDNF levels. So imagine if you, as a well-informed, empowered person who has bipolar disorder, not only takes your magnesium appropriately, but also the proper yoga techniques. Imagine what you would be doing for the health of your brain.
I mean, I can say from experience that when I was doing my final stages of tapering, I was doing a ton of yoga. I was doing at least 1 teaspoon of magnesium carbonate in this form that's here on our table. I was also taking reishi mushroom and acupuncture once a week, and then Wim Hof breathing every night. So there's quite a bit that I was doing in addition to magnesium supplementation and yoga. But nonetheless, from experience, I know these two played a big part.
And magnesium is not the only supplement that can increase your BDNF. There are other supplements I am stoked to talk about in the future as well.
Yeah, you've told me about ashwagandha and inositol, and I'm curious if you know about reishi mushroom. It's something that I've found benefited. I learned about like 21 years ago. It's in the East. It's known as like the mushroom of youth or immortality. And from the experience of taking reishi mushroom, I noticed that generally my gut health, like my bowel movements, became very healthy, and that overall my general anxiety levels became in check. Not something that happened immediately, but over time I just felt overall healthier. So maybe we can talk about reishi mushroom in the future.
I have come across reishi mushrooms in my studies, and I'd be excited about going back and studying it further so we can talk about it in depth.
Yeah.
So yeah, that's just one way or a couple of ways that magnesium can help you with your mood. We talked about how it can help with depression. We talked about BDNF. Now let's talk about how it can help with anxiety. When you are under stress, whether it's due to pain or a life event, due to anxiety, your body goes into fight and flight mode, right? And then you release specific neurotransmitters. You release cortisol and adrenaline. And what ends up happening is when you have that release, your body ends up excreting its magnesium in urine. And then you have a depletion. Now, if it was a once-in-a-while thing, your body's quite resilient and it will replenish itself from your sources. Now, imagine if you are in a constant state of fight and flight.
Well, we don't have to imagine that. Most people in modern life are in a perpetual state of low-dose anxiety, chronic anxiety, and I think based off of what you're describing, a lot of people are urinating their magnesium.
Yep.
Okay.
And if you are from the bipolar disorder community, you are in a constant state of fight and flight, especially when you are in your manic episodes.
Yeah.
And so it would literally be like if you were trying to fill up your gas tank of magnesium, but there's a hole in the tank and it will constantly have your gas be depleted.
So is this something that can be measured in a blood test? And I mean, is that a reliable way? Like, how do you find out if you're magnesium deficient and whether or not you need to get on a supplement?
Well, Imran, that is a complicated question. The answer is yes and no.
Okay.
So the most conventional magnesium blood test there is a magnesium serum test, a
Okay.
serum magnesium test rather. And serum is the liquid portion of your blood.
Okay.
Unfortunately, the amount of magnesium in your serum specifically is less than 1%. And even if you were to have low magnesium in your body, because the level of serum magnesium is so critical for bodily functions, you will always show it being in balance. So if your healthcare provider was to order a serum magnesium on you, it can easily say that it is in a normal range, when in fact your total body magnesium is deficient. There are other blood tests that can get you a better idea of your magnesium levels, but they're not as typically ordered unless you see an integrative medicine provider. So unfortunately, when it comes to magnesium, the tests and the standards of them are not as reliable as with other mineral and vitamin deficiencies. For example, vitamin D deficiency or iron deficiency can easily have a baseline blood level and a post level as a measuring factor.
Yeah, and that vitamin D deficiency I want to talk about in the future because that's a common deficiency for people with mental illness.
And did you know that if your magnesium is deficient, your vitamin D will be deficient?
How?
There's a link there as well, and I would love to talk to you about that, but it's all connected.
So no matter how much sun I get, or no matter how much fish or vitamin D supplement may be,
if your magnesium is low, then you are setting yourself up for a low vitamin D level.
is that the only one, or are there other vitamins that... I guess what I'm trying to find out is like, is magnesium not just we need magnesium for its own benefits that it provides, but also it maybe helps with the production of others?
Absolutely. It's interconnected in the highway of your body and your brain. And it is related to so many other hormones.
Are there any foods that have like magnesium rich? Because I've read about, the leafy greens, kales and spinach. What are some foods that I guess, I always preach, let food be thy medicine and let thy medicine be thy food. Obviously, it's not my own quote. It's from Hippocrates.
If you asked me initially, as a healthcare provider, Nazia, should I be taking magnesium? My gut answer would have been, as long as you have a healthy and balanced diet, you should be fine. You don't need any additional supplementation. And sometimes you have to be careful with supplementation.
Yep.
Recently, after my research and my studies, I have realized that that is not actually the case when it comes to magnesium. In fact, according to the National Institute of Health, up to 70% of Americans are deficient in magnesium. And while there are food sources that you should definitely partake in to increase your magnesium level, such as leafy greens, such as sunflower seeds, even if you were to take a healthy...
Meat.
I don't think that's one of the most highly rich sources of magnesium, maybe a small amount.
Yeah.
But while, if you were to have a fully balanced diet, we're also talking about soil depletion in the industrial model of producing vegetables and produce.
Now I know I'm talking to someone who's trained integratively, because you're talking soil deficient, like nutrients deficiency in soil. Like, okay, you're thinking outside of, and I suppose this is how you probably got in trouble if you're like asking someone who's vitamin D deficient, like, are you eating organic vegetables or, local vegetables? And they'd be like, hey, like, why are you asking these questions?
Well, it's important to talk about those vegetables and incorporating them in your diet. What I have realized is that for certain elements, supplementation is necessary. Same with vitamin D.
Okay.
So there are certain elements and minerals in your body that you could benefit from supplementation. Obviously, with all supplementation, it's important to have a consult with your healthcare provider. With everything, with just like medications, with supplements, sometimes there can be certain considerations. But having said that, the research does show that the majority of Americans are deficient, and that is something we ought to consider supplementing.
Okay. So let me ask you this final question for today. In my experience with bipolar disorder, and just like I haven't had to take an inhaler for 20 plus years, I hope that I don't have to go back on medication, and I've been off for several years now. One of the things that I talk about in my book, The 5 Pillars of Bipolar Recovery, is that sleep is the first and most important pillar to erect and protect for mental stability and from a return to any form of relapse. In fact, I look at it as the canary in the coal mine, that if sleep is what becomes imbalanced, then everything else, all of the symptoms follow. That's my own experience. And in many cases, I can reduce bipolar disorder to a disturbance in the circadian rhythm, a disturbance in being able to fall asleep quickly, stay asleep, reach those levels of regenerative rest, of REM cycle sleeping, and then waking up feeling rested. So talk to me about magnesium, and in any way does it help out? I know that it helps out with sleep, so I'll ask a more direct question, which is how? What's going on at a biochemical level, and how is magnesium helping people sleep better, faster, deeper?
Gosh, magnesium cannot be understated when it comes to its effects on life-changing sleep, especially for someone with bipolar disorder, where lack of sleep can only worsen a situation. It's multiple ways, to be honest. One is magnesium in general just relaxes your muscles. So with your muscles being relaxed, it promotes you to sleep in that relaxed state.
In fact, they add magnesium to Epsom salt for people for muscle recovery. That just made sense. I always wondered why it's there. Okay.
Yeah. And it also, in that same way, relieves restless leg syndrome, which is the urge to move your legs during sleep. And another way it helps is magnesium regulates GABA. And GABA is an inhibitory neurotransmitter that helps you relax.
What is inhibitory transmitter? What do you mean? Speak to a second grader here.
It means that it pulls you down. Like it's a when you're in a state of high arousal, it helps you calm down.
Okay.
Yes. And it promotes melatonin.
Okay.
We talk, melatonin is quite well known as a sleep aid, but if you could focus on supplementing your magnesium and making sure that's at a good level, you are indirectly helping when it comes to your melatonin level.
Yeah, kind of like prebiotics. You take something that helps your body produce.
Exactly. So why not focus on that instead of taking a synthetic product? Instead of taking a product of melatonin, which is the end result, why don't we just supplement our magnesium first?
Yeah, and I mean, in addition to promoting better sleep, it's doing all these other things that you're, talking about.
As you know, melatonin is needed to maintain the circadian rhythm. So it definitely helps in that way. And abnormal circadian rhythms. I looked at a study where it said that abnormal circadian rhythms have been implicated in multiple health conditions, including bipolar disorder.
Oh, yeah. Yeah.
And it has contributed to episodes of mania and depression. And another reason that magnesium helps with your sleep is that, as we discussed before, it decreases the overproduction of cortisol, and a stress hormone. And with the decreased production of cortisol and that elevated response to fight and flight is not as pronounced, and that in itself can help you sleep. So in summary, magnesium can help you fall asleep faster, helps you stay asleep longer, and it also reduces how often you wake up.
For someone who struggled with insomnia for like 2 years straight, when I heard about it, magnesium, and it was actually from my family member's wife who's completing her residency in psychiatry. She's the one who introduced me to it and other techniques. So yeah, it felt like, wow, someone from the healthcare world is on my side.
And in the past, you've asked me about ruminating thoughts and how that can be a factor when trying to fall asleep.
Yeah, so ruminating thoughts are one of the most common features of both depression and bipolar disorder. It's when you think about something that bothers you over and over and over again, and then it can get to the level of a traumatic memory where your body starts to have physiological changes, elevated breathing, elevated heart rate, tension in the muscles, and it's almost as if you're experiencing that memory all over again.
Absolutely. I mean, magnesium helps once again with anxiety and ruminating thoughts by calming the body, regulating the neurotransmitters in your brain, and keeping those neurotransmitters from overfiring and making your anxiety worse. And that is how it also helps decrease the amount of ruminating thoughts and helps you sleep.
Nice. Yeah, I would say what helped with that is, for me, for my uncontrolled thinking before going to bed, is not just the magnesium, but also the mindfulness techniques of meditation, concentration.
It's all connected.
It's all connection, breath work, really,
Absolutely.
doing the kind of breathing that oxygenates your blood and helps calm down the nervous system.
Gets that BDNF up.
Oh yeah, gets that BDNF.
Keeping your serotonin balanced.
The brain fertilizer, right? That's what you call it?
Yeah. Blunting the release of excitatory neurotransmitters. It can help in multiple different levels.
Cool. Well, before we conclude for today, are there any final remarks that you'd like to make to myself, the viewer? It can be about things that we talked about today, or it could be a general message that you have.
Just that, there are some general guidelines for how to take magnesium. Now, what time of the day you take it depends on what symptom you're trying to address. But if it is sleep that you're trying to address, it makes sense to take it 30 minutes before bedtime.
Yeah.
General recommendation for males is around 404 to 420 milligrams, and for females is 300 to 320 milligrams. There are multiple modalities, different ways, and different types of magnesium supplements. Though the two that I'm the most comfortable with are magnesium glycinate and magnesium citrate.
Right, like this one. This is citrate.
So this one that you have, I like it because I looked it up, and it is, while supplements are not regulated by the FDA, they are regulated by other ways of regulation, and this has come up in one of the ways. So that's what I like about it. There has to be quality measures for the supplements you take, and there are databases that you can look at. For natural vitality, it looks good. And while it says magnesium carbonate, it also says that when combined with water, it creates a solution of magnesium citrate. So boom, there you go.
Yeah. And I'm not paid by any of these brands, by the way. These are just very common in grocery stores all over the US and Canada. And they're readily available in conventional grocery stores even.
The only thing I'll say is if you are taking a magnesium citrate, it's great if you tend to be constipated because it can help you keep your bowel movements going. However, if you are on the other end where you tend to have loose stools, then maybe it would be better if you switched over to glycinate, which has fewer of those GI effects.
Yeah, yeah.
So that's just a basic introduction into magnesium. And that's what I am excited about doing as an integrative medicine provider, is to go back to the basics.
Awesome. Backtothe.basics.com maybe. So we'll see.
There we go.
All right. Well, we'll continue the quest to find the right, domain name for you and brand. But in any case, it's been lovely having you, Nazia. And maybe in the future we'll talk about inositol or ashwagandha. Yeah. There's some, it's. I think what the main takeaway I'm getting from today is that it's not a black and white thing. It's not a battle between the allopathic and the what do you want to call it, homeopathic or naturopathic. What I like about integrative is that the definition is in the word.
Yes.
They're trying to integrate the best practices from all of these various modalities. In fact,
if I had to give up my conventional medicine model, then I wouldn't be comfortable being an integrative medicine provider. It's the whole idea that I get to combine the best of both worlds. It's like I am giving my patients a tool belt with more tools.
Nice.
And that's what makes it exciting for me.
Nice. Well, Nazia, thank you so much for joining us today. And we'll talk some more in the future.
Sounds good.
See ya.